Neurological tests. So we're going to do some neurological tests. We'll start with Tinel sign at the elbow, or really that's looking to tap the ulnar nerve going through the elbow. And so then we're kind of coming through, locating, remember it's on the medial side, and you'll see this bump here, and just on the inside of the bump there's a divot. And so then from there, if you were to tap that, you may get tingling on the ulnar side, and that would, if that's what they're getting, that becomes a kind of a positive test for that. Hi, so now I'm going to do the test for the lateral epicondylitis, and so there's 3 tests according to McGee, so method 1, method 2, method 3. And so method 1 is with an arm bent. I've got the elbow, the hand is in a deviated position, the hand is in a fist position and deviated that way. I'm palpating the lateral epicondylitis, don't load yet, and then I'm going to resist him moving up into extension. Go ahead. And if that were to reproduce the pain, that would be a positive for lateral epicondylitis. Test 2 is more of a stretch, and so kind of put arm in this position, and we're looking to put it into a stretch position on the lateral epicondylitis, and that would be a positive. If it were pain, if I reproduce the pain, that would be a positive for test 2. And then the third test is testing for extensor indices, and so then coming through here, I'm looking to resist third finger while palpating that, and oftentimes that is painful. Like you can see how similar it is to the muscle strength test that we did. All right, thanks. Medial test, and so this is a medial epicondyle test, and so what we're trying to do is see if we can reproduce pain through here. And so then what we're going to do is we get you to move into supination. I extend the elbow and then the wrist, and we get pain over the medial epicondyle. So we're stretching that tissue coming through here. But you can also, and this isn't one of the tests, but you often just you get pain if you do resistance as well. So push up, and again going through a muscle test, you can get using strength testing, you can get a sense that that reproduces the pain as well. So this is a valgus test. A valgus test is to test for the medial collateral ligament or the ulnar collateral ligament. Yeah. Remember in the video I showed you the story about R.A. Dickey and not having one of these things, but this is the thing that is stressed for pitchers, and there's a surgery called the Tommy John surgery that's often done to repair this ligament. So it does, for athletes who are doing a lot of repetitive loading on it, it does get irritated. So if we want to kind of put the arm in this position, and we want to stabilize here, I'm going to put a load through that position. So what I really want to see is you loading, so you're putting a stress on that area, and that kind of helps you to differentiate whether the pain is a tendon or ligament. So this is a Vera stress test. The key thing is that I want you to really try and stress and get the elbow to move out. So in this position you're supinated, but you've got it in a slightly bent position. And what I'm trying to do in the medial side is push through that side to create a bend. And what's going to happen with that, if that's positive, if you have pain in the lateral epicondylitis, and it means that it may help to differentiate whether there's a tendon issue or a ligament issue. And so if you're getting positive with that, you generally wouldn't get positive with that with the tendinitis, but you might for a ligament issue. So this is a pinch grip test, and so this is to test a component of the median nerve. And so what you ask your client to do is to pinch the tips of your fingers, your index finger and your thumb together. And what happens is if there's a problem with the nerve, they can't do that. And what happens is that he pinches the pads together. And that's a clear deficit when you go to do that. So so the stepping, instructing them to get the tips together, and if they can't, what they'll do is they'll have the pads together, and that indicates that there's a problem with the particular aspect of the median nerve, the interosseous branch. Alright, so we're going to do joint mobilizations now for the elbow. So there's 3 joints of the elbow, and so then what the important part is our open back position. So we're going to start with the humeral ulna, which is the main joint of the elbow, and so then the open back position for that is about 60 to 70 degrees of flexion and a little bit of supination. So, but mainly we want to make sure we have the elbow in more of a flex position. So there's 2 things we're going to do. We're going to do a traction and a distraction. I know those terms are kind of complicated, but just bear with me here. So what I'm going to try and do is stabilize the arm here, and I'm going to, because I'm taking, it's the humeral ulna joint, I want to be on the ulnar side where my traction comes from. You relax. I'm going to stabilize here and then create, can you see me? I'm going to stabilize on this side, on the radial side, so on the radial side, and then I'm going to push relax, and so then I'm going to pull through, and that becomes the traction in motion. And then to do a distraction, what we do is relax, and we create movement like this. You put your arm down on the table so your elbow is flat, like that. Can you see that? So then from that position, the elbow is flat. I'm going to stabilize here. I'm going to pull that way. That's my pulling motion. Okay, so that becomes the traction distraction of the radial, of the humeral ulna. So now we're going to do the humeral radial joint, and so I've got a towel roll here, and that's going to stabilize. And so then what I want to do is first of all create a traction, and so I'm going to stabilize here. You see the position is different, so I'm in full extension because the humeral radial joint, that closed back position is up like that. So open back position is in this position, so I want to create a stability. I'm pulling on the radial side and I'm pulling down. And then I can do an anterior and a posterior glide from this position as well. So then stabilizing, pushing down, that would be with the towel roll here, stop the humerus from moving down, and I'm putting pressure down, and then I could do it coming up as well, and that gets the humeral ulna anterior and posterior glide. So now I'm going to do the radial ulna joint, and so you see in this position here the arm is in pronation and the elbow is bent, and what I'm doing here is trying to, so now the radius is on top, and I'm going to do the stabilization happens here. I'm going to move the radius forward, and that becomes the anterior glide, and then I move the radius back, and that becomes the posterior glide.